By Adam Geller and Heather Hollingsworth, Associated Press. When Brittany Palomo was hired as a nurse in March, her parents tried to talk her out of it, fearful of the fast-spreading coronavirus. All the more reason, she told them, to start the career that had been her long-held dream. The pandemic, though, is a nightmare, one that has now claimed 300,000 lives in the US and counting. Wake up, my little girl, wake up. Palomo's mother, Maria Palomo Salinas, screamed, her grief echoing through a Harlingen, Texas, hospital, when her daughter died of COVID-19 complications around 2 a.m. on a Saturday in late November. Palomo was 27 and, as a healthcare worker, was probably weeks away from getting the new vaccine that could have protected her from the virus. Instead, she became yet another victim of the relentless outbreak whose U-toll is accelerating as it eclipses another round number mark. The numbers are staggering, the most impactful respiratory pandemic that we have experienced in over 102 years, since the iconic 1918 Spanish flu, Dr. Anthony Fauci, the government's top infectious disease expert, said days before the U reached the milestone. The U crossed the 300,000 threshold on the same day it launched the biggest vaccination campaign in American history, with healthcare workers rolling up their sleeves for COVID-19 shots Monday. The death toll was reported by Johns Hopkins University from data supplied by health authorities across the U. The real number of lives lost is believed to be much higher, in part because of deaths that were not accurately recorded as coronavirus-related during the early stages of the crisis. It took 4 months for the virus to claim its first 100,000 American lives. But with cold weather driving people inside, where the virus spreads more easily, months of reluctance in many states to require masks, and an increase in gatherings over the holidays, some public health experts project 100,000 more could die before the end of January. It can certainly feel like you're standing on the beach and sandbagging a tsunami, said Dr. Leon Kelly, who attends to both the dead and the living as coroner for El Paso County, Colorado, and deputy medical director of its public health department. Already, the number of dead in the U rivals the population of St. Louis or Pittsburgh. The toll is equivalent to repeating a tragedy on the scale of Hurricane Katrina every day for 5.5 months. To me it represents an extraordinary failure in our response, said Jennifer Nuzzo, a public health researcher at Johns Hopkins, contrasting U officials' scattershot response with the massive mobilization after nearly 3,000 Americans were killed in the 9/11 terrorist attacks. To think, now we can just absorb in our country 3,000 deaths a day as though it were just business as usual. It just represents a moral failing. The U.